Okay, so we're going to talk about mainly clinical pathways, clinical risk assessment tools, and nursing care plans. Nursing care plans, clinical pathways, and clinical risk assessment tool all play important roles in nursing. They are essential to delivering the appropriate care to patients. All vary but are used together to give us a comprehensive plan of care, right? I may be rushing through these PowerPoints because we have already discussed the key concepts in the previous presentation. Nursing care plans will differ in every place you work, right? So do not take this as a face value of all these documents that it's going to be same, but definitely the concepts and principles going to be same. This can also be called as care tracks or care maps. Nursing care plans are used to outline the patient care on a daily basis in place of writing notes, but not eliminating writing notes if needed. We told that time nurses that regardless of you have a pathway or care plan, you are writing the notes as a systematic approach. Okay. There are more elaborate clinical pathways that show the relationship of sets of interventions to sets of intermediate outcome along a timeline. Clinical pathways are standardized, evidence-based, multidisciplinary management plans which identify an appropriate sequence of clinical interventions, timeframes, milestones, and expected outcomes for an homogeneous patient group. I remember while I was working in a private hospital in Australia, we had 3 surgeons or 4 surgeons performing similar surgery, right? And 4 of them had different clinical pathways, completely different clinical pathways. Same surgery, but we used to, just take the pathway out. Oh, this surgery is done by Mr. Stevens. Okay, so this pathway is going to be applicable to his patient. So not necessarily that you would have the standard pathway in the ward where you're working, but according to the surgeon's preference and choice, you could have different pathways too.
Shouldn't the surgeons actually
they should come together?
Shouldn't they collaborate and actually come to a unified?
As you just mentioned, some surgeons, so you have got this big personalities. No, this is my way of care, and a lot of time when working in a cardiothoracic too, a lot of time the surgeons are from maybe UK school of thought, or they informed by American surgical procedures, so they informed by Australian. The ways are completely different, the intraoperative care, the post-operative care. So definitely you need to just follow on what they prefer. Exactly, yeah. Clinical pathways are made to follow certain policies and procedures, and there is generally one for a certain area, illness, and procedure. Are not generally patient specific, but changes or addition can be made depending on the patient's plan of care, right? Patient is having daily dressings, can write the type of dressings used. All care plans must have a patient label, have a commencement date, time, and should be signed on a shift by shift basis. Okay, clinical risk assessment tool. The Office of the Senior Practitioner DHS defines risk as the chance of somebody getting hurt, being in danger, or doing something dangerous to other people. Clinical risk assessment tools are specific assessments that are used to measure levels of risk for certain situations, procedures, and outcomes. In the clinical setting, nurses use a variety of clinical risk assessment tools that will help with the patient's care. Okay. So any examples? False risk, Braden scale, anything else? Self-harm, yes. We used to have a mobility chart as well, so mobility risk plan. Okay. Braden scale used to predict the pressure sore risk, so that's the Braden scale, but I have circulated one for you to have a look. False risk used to predict the likelihood of a fall occurring. When we should be filling out this risk assessment form? Admission, very important. And then after admission, then yeah, so different hospitals have got again different protocols. Few hospitals, they just prefer that every alternate day. Some prefers maybe every 3 days, after every 3 days, right? So it just depends, you just need to follow. But I always used to tell the nurses that always see if the patient's condition change, regardless of it's within the protocol or not, of course you need to fill out. Okay. or the patient's condition get better, then you fill out as well. Okay, and then one at the time of discharge. You know why it is important? So just have a look this, and then we're going to talk about it, why it is important. So that's the false risk. An approach to improving the quality and safety of healthcare by identifying circumstances that put patients at risk and then acting to prevent or control those risks. Clinical risk is usually reviewed by the quality committee. So once you fill out this incident form, initially when there was a paper-based form was introduced, that form used to stay only with your unit manager, right, in her file. But now with this centralized system, the form goes to, for example, if the patient has got false risk, the form goes to unit manager, and form goes to quality committee and whoever the other concerned people, so that they all work together, right? Because as we talked about it, the purpose is not the punitive, or the purpose is not to actually have measures in place just at the ward level, but from the systematic approach as well, or from the systems point of view as well, that okay, what measures should be in place in the entire hospital in order to prevent this kind of risks, okay, and the control. Okay, risk assessment tool. So don't worry about this, but see, this is the color coding. So whenever you put on the risk assessment form, yes, patient is on low risk, patient is on medium, or patient is at high risk, they get that color coding, and according to that color coding, control, preventive measures and funding is actually asked or sought. Okay. Clinical risk assessment form should be filled out on admission so that clinical pathways and nursing care plan can meet the needs of the patient.
Would you like to know more? You're welcome to contact our friendly staff on 1800 22 5283. We'll be happy to answer your questions.